Hello, my name is Dr. Brian Raid, and I'm a naturopathic doctor. And this is a video about whether I have ever seen heavy metals contributing to muscle twitching. Someone had posted this question on one of my other videos, and so I'm just answering that question here. So I have seen that in some patients. I've had several patients to date where they tested as having elevated lead. I believe is the only one that I've seen elevated on heavy metal testing, and that by treating the lead, it improved or resolved the twitches. I mean, on paper, mercury can cause mercury can cause that, and on paper it should be a fairly common cause of that when heavy metals are involved, but for whatever reason I've mostly seen that with lead. Granted, the chelators that we use to get rid of lead, specifically something called EDTA or sometimes DMSA, can help to get rid of, or can and do help to get rid of mercury as well, so it's possible there's some overlap there, but the lead was what tested so high on those cases that I've seen. Now, with that being said, of all the hundreds and hundreds of patients that I've had who have elevated heavy metals like lead and or mercury and or other metals, I would say it's a fairly small minority that actually have twitching as a symptom. So I certainly wouldn't go out to say elevated heavy metals commonly causes twitching, but in patients who do have chronic twitching issues, muscle twitching issues, every so often lead has been a causal factor there. I have seen twitching being caused by other conditions as well. So sometimes when we're treating patients for chronic or persisting infections like borreliosis, aka chronic Lyme disease, or co-infections, things like Bartonella, Babesia, Mycoplasma, etc. Sometimes when we're treating for those known or clinically suspected infections, we'll see twitching getting better. I've had some patients that have microbial hypersensitivities to some of the microbes that I just mentioned, or sometimes to yeast, or sometimes to other microbes, and they have twitching as part of their symptom picture. And by treating that microbial hypersensitivity with things like low-dose immunotherapy, that gets better. I've had some patients where their twitching doesn't get better until we properly support their mitochondria. So there's several different things that can underlie twitching, but I have seen heavy metals be a causal factor there for some patients. So I hope that answered the question. If it didn't, just post in the comments below and I will flesh it out in a future video. And I hope that this information was helpful.